Hello, everybody. Welcome back to the first episode of AT Talks. And I think 2 months, or every 2 months in a couple of days, we've had a rough couple of months with the whole pandemic and being furloughed and refurloughed and laid off and transitioning work. But AT Talks is back. Today's topic, we're with Paul, and we're going to talk about building a sports medicine department, building that foundation, and then growing that department into holistic, collaborative athletic healthcare. So, Paul, if you could quickly, not quickly, take your time, introduce yourself to the 6 or 7 people that will watch this that are not Wolfpack members.
Thanks for having me, Tom. Paul Rupp. I'm an athletic trainer at Oakland High School in Northern Virginia. I've been there 20 years now. I just finished my 20th year, about to start year 21. Prior to that, I was at St. John's University for 4.5 years. Prior to that, I was a GA at Syracuse University for 2 years. I got my master's there in phys ed with a concentration in exercise physiology. And I got my bachelor's degree at East Stroudsburg University in Pennsylvania.
All right. What did your job look like in terms of the sports medicine department when you got there 20 years ago?
Well, it's funny. There was a slightly older gentleman that had been there 20 years when I got there. When he hired me, he says, "Paul, I'm riding your coattails. I'm going to last as long as you'll let me last." And he had a team physician that was orthopedic who was working with the team formerly known as the Redskins. And we were trying to contact him, and he wasn't answering. So we got some notes from some other athletes from their team, from their family doctors, and we didn't hear from this doctor that's working with the Washington team. So I reached out to one of the other doctors. And sure enough, the first game, there's 2 orthopedics on our sideline. My head athletic trainer and I, we didn't communicate very well. And sure enough, it was a really awkward situation. So it's really important that you have the communication on your staff.
So you had the team physician, which was working for the Washington football team. And then you brought in a second orthopedic physician. Okay, so how did that play out after that? Was that a one-time deal, or?
Yeah. I walked down to the new physician and said, "Listen, I didn't communicate with the other athletic trainer, and he communicated with the other doctor who's been our team doctor for a couple of years now, and I'm really sorry to waste your time." And he understood. He was like, "It's all good," and it was fine. And so after a couple of years, that doctor stayed with us, and he kept working with us, and they stopped showing up for games. He'd call us and say, "Hey, I can't be there. I've got this event," or "I can't be there. I got this. And I got somebody filling in, or if you need me, just call me." And so, I think we went like 5 years without him stepping foot on campus. And I was getting old in a hurry, and we had some other doctors that were contacting us saying, "Hey, we'd love to be your team physician." And, No, we already got one. We already have one. Thanks anyway. Then there was another one. The son played football for us and played lacrosse and golf for us. And he really wanted to be part of the team, and I really had a problem with a parent of an athlete, because we had a conflict with a parent of an athlete being our doctor. So I kept putting them off, and then when his son graduated and his daughter graduated, I reached out to our original doctor and said, "Listen, if you don't really want to do this, I understand, but we want somebody that wants to be here." That's the key. I want somebody that wants to be there, wants to be part of the organization, and wants to take part in what we do as a organization. And he kind of understood, and he was kind of getting up there, and he was getting ready to sort of start to retire and fade out. And his son was going on to play football at their other high school. And so he was kind of comfortable stepping away, and we were able to get this other doctor come in, and we really created a good family organization.
You had these other doctors reaching out to you. Was that just because of word of mouth of what you were doing at the school and the athletic healthcare you were providing, or is that a culture thing where you're at?
I think it's more of the population. We're fairly dense population, Fairfax County, right outside of Washington, D.C. Every third house down the road is either a lawyer or a doctor, one or the other. So there's so many medical organizations in the area. You can't throw a stone without popping a doctor. So and a lot of them really want to help the community and want to support the different organizations. In our county system, we have 25 high schools, so we got to fill a lot of roles. So there's quite a few doctors that just want to support their community, and this is a great way to support their community. So they were trying to reach out and be part of ours.
Okay, so you're a few years in, you're going through a couple of different physicians. When did it get like more settled and more consistent for you and your team?
Well, when I was hired, we had an orthopedic team physician and a family practice team physician.
Wow. Okay.
And the family practice team physician, she actually got a gig with University of Maryland. So she left, and so I contacted our original doctor and said, "Hey, I'd like to replace her with a family practice doctor. Who do you recommend?" And he set us up with a family practice organization that he'd worked with, and talked with them a little bit. And there was a real strong practice in our community, and one of their physicians was happy to help us. So he came on board, and again we started to grow. And then unfortunately he was a competitive road bike racer. And he got into a real bad accident, went head first to a telephone pole, and really struggled for a long time. So one of the other doctors in our practice, her daughter graduated from our school, so she was familiar with us, and she joined our team. And when she came on, she brought on they have a residency program. And at the time that she was coming on, they were developing a sports medicine fellowship. So they brought their fellowship, and they used us as part of their application to create the sports medicine fellowship. So we were an off-site medical facility that they could send their fellow to learn about sports medicine. So their fellow comes out to our campus and is on our campus for our athletes. We have it set up that they come to us Tuesday afternoons, and then they come to Friday night football games and one of the basketball games that week, and then one of the spring sports each week. So we have a doctor on our campus twice a week, every week.
Wow, that sounds amazing. It almost sounds unreal for the area that I'm in, that it's very, very difficult just to get a physician out to a home football game or a big sectional or regional, let alone someone you can consistently see week in and week out and refer patients to.
I think that starts now. I think you need to network, and you need to find somebody, like I said, that you need to. I think there's three tricks to creating your sports medicine team. One, you need to be self-aware. You need to know what your strengths are and what your weaknesses are. You need to know what your community needs, and then you need to find somebody that's willing to fill your weaknesses. So if you're really strong orthopedically, do you need an orthopedic team doctor? Probably not. You could probably use a family practice or even an ER, an emergency medicine physician. Think about who do you want on your sideline on a Friday night? You got a broken arm. You know it's a broken arm. Are they going to play? Probably not. Do you need an orthopedic to tell you that? But you get a helmet to the spleen, and you're not sure, is it a spleen injury? Did he just lose his wind? There's a lot of things that could be happening in a gut injury. Who do you want on the sideline, an orthopedist or emergency medicine? So there's a lot of things to weigh in there. And that's kind of why we created that holistic team where we have the orthopedic and the family practice. The family practice physicians with their residents, they're doing rounds in the ER constantly. So they've got those skill sets pretty uniquely.
What other components have you added to that collaborative team, to that holistic approach over the years besides those two physicians?
So we have a dentist that comes out to our facility twice a year. He takes impressions of any athlete that wants it, takes an impression of their mouth. I get the mold back, and we make custom mouthpieces in the athletic training room. And with that, he's on my speed dial. So you get the soccer player that gets kicked in the mouth and loses a tooth. I can text them or call them right away and say, "Hey, that's what I got. Where do you want to meet them?" And usually we'll meet them right in their office. Sometimes they'll say, just put it back in there. I'll see them tomorrow morning because it's not too bad. Or sometimes it's, I'll meet them in 5 minutes in the office. It just really depends on the scenario. But we've got them on a speed dial, so we have access to a dentist whenever we need. And that's come in handy lately. We had a wrestler. We really don't understand how it happened, but one of our heavyweights got rolled, got tossed a little bit, and somehow he hooked the bottom teeth on the mat, because the mat's a little soft, and fractured 3 of his front bottom teeth, kind of tilted them out. You don't really know how you get thrown with your mouth open and land on your bottom jaw and not on your nose, but things happen. That's one of the excitements of high school athletics. But on top of having the orthopedic, the family practice, the sports medicine fellowship, the dentist, we also have a meteorologist on our team.
Okay, so you got a lot going on. That's amazing.
I follow a meteorologist on Facebook, and me being from New York, I love the snow. So in the wintertime, I really follow his snow reports, and they're pretty accurate. And we had an incident on a Wednesday night in the spring. Soccer team's playing, lightning storm comes in, we get everybody off the field. I go in, pull up weather.com on the computer, and it's not red coming at us, but purple. We're like, we're not going to get this in. We'll cancel and we'll reschedule. So we did that, and as we're leaving, the skies cleared up and we got no storm. We could have gotten the game in. Well, we rescheduled for Wednesday. Everybody's left already. So the following Wednesday, the exact same scenario happens. Storm rolls in, lightning, we get everybody in, go to weather.com. Purple's coming at us. We're not going to get this in. We go to leave, and the sky's cleared. So now I reach out to this guy on the internet, and I say, what's a good website I can go to? My coaches are going to stop listening to me. We're going to get in trouble, whether they're on the road or whatever. We're going to get in trouble with the weather. He said, well, this is what I do for a living. He was a former military meteorologist. So he'd forecast the weather for maneuvers or whatever. He retired from the military and created his own practice here in Virginia, doing forecasting for futures traders, farmers, construction people that work outside. Well, we work outside. Why couldn't we benefit from his skills? So he gave me his cell phone number for that spring. If I saw a storm coming in, I could text him or call him and say, DT, I've got this weather coming in. What do you think? And I'd hear him banging on the computer, and he'd call me right back, and he'd bang on the computer and say, oh, no, the storm's going to go south of you. You don't need to worry. You're safe. Or there were a couple times where he said, oh, this is a big one. It's coming right at you. Get them off the field. Get them safe. And he was pretty, there wasn't many times where I was like, DT, you're killing us. And he was pretty much on the ball, and we had that access to him right away.
What other providers do you collaborate with on a seasonal basis, or that you like to refer to?
Well, I've really paid attention to our student body and their parents, and we had a former dancer and gymnast, two sisters. Their dad was a chiropractor / PT. He was a dual credential. And he wasn't one of those chiropractors that wanted you to come in every other day to get your back cracked and wasn't doing any healing. He wanted to solve the problem and fix it and move on. And yes, he has some holistic beliefs like most chiropractors, and that's okay. That's not a bad thing. But we use him as a reference now. He's been part of our team for probably 12 years now, 13 years. We've had a couple of physical therapists in our area, but unfortunately they've kind of moved on or retired. So I'm in the process of finding some physical therapists in our area. And I don't refer out too much. It's more of, hey, I'm having ACL surgery right before Christmas break, and I need somebody to start my rehab, things like that. But our parent, there are people that want the physical therapist in the area. I've actually had a parent tell me it's better if you pay for it, isn't it? I told that parent they can write me a check if they want. And they're like, oh, really? I could do that? Like, no, I'm kidding. No, I can't take your money in that way. I'm already get paid. But they ended up making a donation to the school. So, it worked out that way anyway. So I bought 2 treatment tables out of it. But yeah, we use a physical therapist, chiropractor, dentist, ortho, family practice, meteorologist. Those are the ones that are on hand. Our school has a psychologist and a social worker in the school during the day. So we have access to those facilities, those specialists as well.
And what's your relationship with your nurse like?
Oh, it was real strong, but she just retired. So we've got a new one coming in. I've sent her an email that she hasn't replied to yet, but with all that's going on in the health field, I'm sure I'm kind of low on her totem pole right now because we're not going into school until after the first quarter at the earliest. So, but we'll get together and we'll form a great relationship. She, when we have athletes with concussions, she is one of the people on my list. So if an athlete has to lay down for a while because they're overworked or whatever, they can go to the clinic and lay down for 15 minutes to a half hour and just kind of decompress and relax. And as long as I communicate with her, she knows they're coming. We have that set up. We've had that set up in the past. I'm hoping that will continue now. But it's a new person that I kind of have to get to know.
Can you take a moment to elaborate the importance that a school nurse can have on an athletic trainer's care and the patient's care throughout the day when, if you're working in a secondary setting, you might not get to the school until 1, 2, 2:30 when the nurse is there at 7 a.m. and they're an extension of the care. Can you talk about that a little bit?
Well, any medical professional that has constant contact with the people you're working with, whether they're an athlete or not, it's vital to have great communication with. And yeah, like you're saying, if they're getting in and they're seeing some of those students earlier in the day, you've got a good relationship. We often get the email, "Hey, I saw Thomas B. This afternoon. His headache was really fired up during math class." So we get that kind of communication, and I thank them, and we communicate, and especially now with the contagious diseases, kids with wrestlers with their skin diseases, we communicate back and forth because our school nurses are hired by the county Department of Health. They're not officially employees of the school system, so they can help with that access with the Department of Health. Heaven forbid, you know, okay, I'm going to age myself a little bit to you, Tom, but I was working when H1N1, the swine flu, was an outbreak. And anybody that had any kind of flu symptoms, we had to communicate with the Board of Health. And our school nurse was that liaison to the Board of Health. So it's really important to have a great relationship and great communication with the nurse, and especially in that situation.
Yeah, I absolutely agree. If you're a practicing athletic trainer and you don't have a good relationship with your nurse, or if you don't know who your nurse is or what they look like, or you don't ever talk to them, go out there and start that relationship because they can be absolutely vital to your athletic healthcare team. Do you
And
have?
it's really important also to know what their role is,
Mhm.
because there have been a couple times during the school day. When I first hired, I had to teach. I taught during the day, and then I would go in the athletic training after school. And I was teaching one day, and we had a girl had a bug bite. She said, "Mr. Rupp, this bug bite's killing me. What should I do?" So it's easy. It'll put a little ice on it. It'll calm down. It'll decrease the histamine response, and it won't hurt so much. Why don't you go down to the clinic? And I can't leave class, but why don't you go down to the clinic and get a quick bag of ice? They'll give you 4 cubes, put it on there, come back up. Girl never comes back. So after class, I go down to the nurse. I say, "Hey, did so and so come in and see you about a bug bite on her hand?" "Oh yeah, we had to call 911." So what? She had a bug bite. "Oh, she was having an allergic reaction. We had to call 911." "Are you really?" "Yep." And she pulled out her manual. She had to follow the manual, and manual says any allergic reaction is a 911 call. All right. Needless to say, I don't send people in with bug bites anymore because you don't need to go to 911 because of a bug bite. So it's important to know what their role and what their expectations are and what you're sending to them. At the same time, we had an athlete who was working out in weight training class, went to put the dumbbell on the rack, and his finger was in the way, and he obviously broke it. There was an obvious deformity in the finger. So I put a splint on it, give him a bag of ice, and sent him down so he could do the proper paperwork and documentation that he got injured during the school day and all that kind of stuff. And she came down with steam coming out of her ears. "What are you doing? You're not authorized to treat." I said, "I did basic first aid. Calm down. I splinted in the position it was in. I did no further harm. Relax." "Well, you're not authorized to do that." And I said, "Oh, by the way, I'm licensed medical provider, and yes, I am authorized to do that. Let's slow your roll a little bit and let's communicate, and we can have a conversation about this." And she wasn't happy when I was right, but you know,
Does your school have any type of fitness staff, strength coaches, wellness performance coaches, any type of fancy way to say a strength coach?
not specifically. We have a PE teacher that teaches most of the weight training classes. We're on a block schedule on 8 periods, so 4 periods each day. I do even classes one day, odd classes the next day. And the teachers are assigned 5 classes, so they get one period. The 8th period is a steady. It's a what do they call it? It's basically social bonding type of thing where the teacher kind of lead a discussion on what's going on in society, and how we can coordinate just different topics and what's going on that cause teenagers stress and anxiety. But then they teach 5 classes and they get 2 prep classes. So they get 2 periods off. So we have one teacher that teaches, PE teacher that teaches 5 weight training classes. And then we usually have one of our football coaches who is that teacher. So he does his after school stuff as well and will help out most of the teams that ask for help.
Mhm.
And then a lot of a lot of the sports, one of their assistant coaches usually has some experience in weight training. So they say, and sometimes it's kind of scary. I've been in there working out, and um, some of the things you see them doing is quite scary, and I have to stop my workout to control the scenario. So.
Uh, Now, are there any of those personnel people that you like utilizing on your healthcare team that you'll send maybe an athlete that for the most part is healthy, but they have some deficits, and you're just like, oh, you just need to get stronger. You need a weight room program. Go see coach, whatever, and they'll get you something, or not so
So,
much.
sometimes, and sometimes we communicate. You know, you're finishing up the rehab, and they have a little bit more sports specific. You want to focus, you know, maybe an ACL is coming back, and you want to focus a little more on sports specific dynamics. And then we'll get with that coach, and we work some of those final progressions back into sport through the coach, through the weight room, and through some of the sports specific pre-practice stuff. And we coordinate with the coaches together on that.
Can you go into? I don't know a lot of schools that have a social worker or a psychologist on staff. Can you talk about some dynamics with that? Because as you know, mental health has taken a big hit the last 6 months or so. So they're going to be extremely critical once or if or when we do return to sports and school.
Absolutely. I'm a big proponent of the mental well-being and the mental health and mental facilities. Our social worker actually taught a class on psychological first aid and understanding when a kid is getting to a point where they need help and being able to recognize that and have an emergency action plan, a psychological emergency action plan. And we've had to put it into function. 3 years ago, it was just a, you know, every year you have that one injury where you have like 40 concussions in your football program. And then the next year you have like 8 shoulder dislocations. And the next year it's
Yeah.
5 patella dislocations. Well, one year we had a psychological barrage. Cheerleading coach walks in and now here's a trick to this, and understanding when you create a psychological emergency action plan, everything tends to happen at like 7 o'clock at night when nobody else is around. So at about 7 o'clock after cheerleading practice one night, cheerleader coach walks in, one of the girls, and hands me a fistful of razor blades and says, "Hey, so-and-so has a history of cutting herself, and she's really worked up, and she's afraid she's going to start cutting herself again. She just handed me these razor blades. What do we do? Uh, let's get you some help." And part of her anxiety was she was already injured, and that was firing her up, and her dad was coming to pick her up. So we were able to sit dad down in the room and let him know what she said and what was going on. And he was understanding, and said that she was already seeing psychological counseling for that issue. And the sessions had been kind of separating a little bit, time to start amping them back up again. Uh, One night at about 11 o'clock at night, cross country coach calls me. "Hey, four of our athletes just called me. So and so left a message on Facebook saying, 'I love you all. Never forget me. Good night,' and won't answer his phone. We don't know what to do." So we had to get our athletic director on the phone, and we call our athletic director DSAs, Director of Student Activities. So if I slip and call it a DSA, you know what I'm talking about. We had to get our DSA on the phone and this school head guidance counselor, and we called the family right away. Probably within 10 minutes of that phone call, we had the parents on the phone breaking down the kid's door, and fortunately he was okay. But episodes like that, there was like 7 in a row, one fall, where it was 2 girls were cutting, one girl with an eating disorder, another girl wouldn't get out of her coach's car. Her father was an Olympic runner, and her times were not matching his, and she was afraid to go home to face him. Unfortunately, our girls' basketball coach happens to also be a guidance counselor. So we were able to, she didn't want to talk with me because I was a male, but for some reason he was able to convince her to come in and talk with him. And he was able to talk her down and get the parents on the phone and have a conversation and make sure she was safe to go home. And that's the biggest thing, is to make sure they're safe. You can't send them home and then have something bad happen and, you didn't do anything. And that's why it's important that athletic trainers recognize that we are a mandated reporter.
Absolutely. A lot of dynamics that go on in
Yes,
athletic healthcare.
yes. And including with concussions. One of my favorite lines that I learned about with concussions is concussions like bullies. They find your weakness and they pick on them. So if you have a prior history of anxiety or depression and you get a concussion, well, it's all going to be amped up and it's going to be turned way up. So your anxiety is going to be through the roof and your depression is going to be through the cellar. And if we let a kid go home knowing that they had some depression already and there's a good chance that they're going to go off the edge because of this concussion, we need to make sure that somebody's keeping an eye on them and they're communicating, and they need to understand that this is a temporary thing, that it's not, they're not permanently going to be depressed. Once their concussion recovers, their depression will return to what it was. And then they can manage it a little easier, but they can't think that this is going to be a permanent thing now that they have a concussion, that they're always going to be this anxious or this depressed or whatever the case may be. So it's important to recognize those prior symptoms when you're doing your evaluation of your medical history on a concussion case.
Well, we also need to recognize what type of environment are these kids going home to?
Absolutely.
Because that can play a huge role in their recovery, and not just for concussions, for any type of
Absolutely.
injury.
I mean, nutrition is a huge part of the recovery if they're not getting proper nutrition because whatever reason, yeah, that's an issue. And I always say the mind is an incredible tool. A lot of was it Plato or Socrates who used to preach sound mind, sound body. If the mind's not working right, the body's not going to work right. So if kids really super anxious or depressed, or their boyfriend or girlfriend broke up with them, or they've got 5 AP tests that they failed 3 of them, and the world's crashing down on them, you need to support them more than just physically. You need to support that emotional as well.
Yeah, there's when you do your symptom score list and they can't fall asleep, they can't stay asleep, and they rate that super high, and then you just move on, compared to, well, what's wrong with sleep, and they say, well, we have 8 people in the house and there's 3 beds, so I sleep on the floor. Or
Yeah,
the AC doesn't work, or there's no heat. There's all types of issues that we sometimes don't even think about, and
absolutely.
then it prevents us from delivering the best healthcare we can deliver and helping that athlete, in ways they need help. But we have 8 minutes left.
Yeah.
If you could add another component, another profession, person, piece of equipment, to make your team better, to expand your team, where are you looking?
There's always equipment to add. There's always a new gadget coming out. But the strongest tools you have are your hands and your telephone to communicate with the parents and doctors and such. From a practitioner standpoint, I would really like to have, and usually one of our fellows tends to be a DO, but they're so into learning what they're learning, they're not teaching a whole lot. I would really like somebody to be able to teach me some more, some manipulation things, some back, the hip. The hip is probably my weakest joint. So somebody that can help manipulate that hip and low back scenario, the kinematic chain of the low back, the hip into the knee. That's probably my weak area, to have somebody that can help me learn more about that and learn tools to manipulate and manage some of those soft tissue areas would probably help me the most.
And you gave 3 pieces of advice earlier: the reflect on your strengths, your weaknesses, do an analysis of what your community needs, and then interview those providers. What other tips or tricks or knowledge would you like to say to athletic trainers in their first or second or third year at a high school, at a college, where they're brand new and they're just kind of thrown in the fire and, just go ahead and swim?
If you're building your own team, like a lot of times you're being assigned, your athletic director plays golf with the local orthopedist, and so he's your orthopedist whether you like it or not. You need to really build a good relationship with them and communicate with them and be able to have them understand what your role is and what your expectations are, and have an understanding what their expectations are of you. But beyond that, if you're building a program, really need to have an image of what you want to provide and what your sports medicine team looks like. Some people like the autonomy. They want to be left alone. They want somebody they can call and say, hey, I'm doing this. You okay with it? Yep. Okay, great. And I'm doing my own thing and leave me alone. Me personally, I like having that family, that bond where I can call any one of my doctors at 11 o'clock at night after a basketball game or after a wrestling match. Say, hey, I've got this. What do you think? This needs to be seen right away. When can they get in to see you? I don't want to feel awkward about having to do that because I only talk to my doctor once a month. You know what I mean? And I want all the tools at my disposal. I want to fill all the gaps of my weakness. I'm not good with medical stuff. I'm not good with the internal organs. I know where they are and I know what they do, but to be able to determine what's a true medical emergency, I like having that backup. So I like filling those areas that I'm weak with, and having that communication. And when you're building that team, interview those people, have an in-depth conversation about what are their skills, what do they like to do, what do they want to see, how do they want to communicate with you, and when can they see your patients. If you call them, you want to be able to get your athletes in right away. It's kind of a perk of having that bond. You don't want to call your team doctor and have them say, yeah, I can see him in about 3 weeks. That's not helping your football program or your basketball team or your field hockey team. You want to be able to get those athletes in right away and get them start that treatment process, whether it's just a bruise, whether it's a bone bruise, whether it's a fracture, a torn ligament. What can they do, and how can you get them back on the field as quick as possible? And if they can't be seen for 3 weeks, that's not super helpful. Might as well go to an urgent care at that point.
Yeah, absolutely, absolutely. All right, is there
Which
any? Or go ahead, You're good.
but that's another important tool. What's your local emergency room like? What do they expect to see when you get a football player or a lacrosse player or even a wrestler or baseball player with a spinal injury? What do they expect to see when you send them? And what should they expect? What are you going to send them? You need to have that conversation with that ER, that urgent care, all those facilities that are in your area that your athletes might go see. You need to have a relationship with them and know what they want and what to expect from you,
Well,
including your EMS.
let's dive into that for. We got a couple minutes. Let's talk
Yep.
about EMS and building that, um, that connection. So at last year at my school, I invited out. We have Superior. It's a third-party ambulance system. EMTs, paramedics, depending on who's on duty. We invited Superior out, and we invited our firefighters out, and I tried to take them through every single facility. These are the gates you'll enter. This is how to get your way around. This is what we're going to do in case of these emergencies. Um, but let's talk about how critical that is.
A hugely important tool. And again, you need to know what they're going to do, and you need to know what they expect from you. If I put a splint on a kid for a broken elbow, a broken forearm, are they going to come in and take my splint off and put theirs on? If that's the case, why am I going to put one on? What's their response time? I have not in 20 years. I have not. It's never taken me longer than 4 minutes to get EMS to my facility. You're in the down south West Virginia. It could take you 35 minutes, especially if there's an accident on the highway because there's only one rig and they're dealing with the accident on the highway. So they got to call on the third team from 45 minutes away. So you need to know what the response time is and how that all works. Our ambulance crew is part of our fire department, and they will not sit on call at a school. They may drive by and watch part of our game, but they're not truly on call for us. They're just happen to be sitting there watching. So I have to know that I'm not going to have an ambulance on my field on a Friday night. I have to have plans. How am I going to get EMS in? So we communicate with our school resource officer. If a police officer calls for 911, calls for an ambulance, it gets there faster than calling through 911. So we have hand signals, and my team, my school SRO knows if I tap my head, I need my team physician. If I tap my shoulders, I need the ambulance. And if I stand up at the 50-yard line and I'm doing this, my SRO knows he needs to get on the radio and call for an ambulance and get them there and where they're coming to. And our administration knows to look for the ambulance and escort them up to the field.
Yeah, see, and that was something I never thought about. My first year and a half, if we had an emergency, I was calling 911. And then my second basketball season, I'm looking at the police officer with his, walkie-talkies and his radios.
Sure.
I'm like, Tom, why don't you just ask the police, hey, if I need to call an ambulance, will you call them for me? And every police officer I asked was like, absolutely, we'll call them.
Yeah.
So
again, it goes to that communication and signaling to them. Do you have a radio that you can radio to them? They're probably on 4 channels, so they may not hear you radio. And so it's important to have those hand signals, and they need to know. And you can be whatever hand signal you like because you need to remember them, but they also need to be able to remember them. So be able to explain to them why that's your signal and go from there.
Yeah, and when that ambulance crew arrives, preferably you want to know the roles and what each person is going to do before
Mhm.
they show up, and then you're butting heads because
Right.
you're trying to provide your care and they're trying to provide their care, and now you have a dispute in care.
That's the importance of that practice session, bringing the team, bringing the EMS out to your field, and make it a training session. Don't come out to say, "Hey, I want to show you what we do." Make it a training session because they get education points for it. Like we need continuing education, so do they, and they can count that as continuing education points for themselves. So make it worthwhile for them to come out.
And if you're a young athletic trainer watching this, you're going to get both sides of the spectrum. Last year I called 2 ambulances for football, and the first crew, they were the type of crew where we don't like, yeah, you're whatever, but this is my scene and we're doing this our way. And the second time I called, that crew was like, hey man, you do whatever you need to do and we're here to help. So you
We're
get
about
both
to get kicked
sides.
off.
Yeah, we got less than a minute, but it'll kick us out when it kick us out, and then we'll go to the wolf pack.
Absolutely.
Hmm.
Absolutely. But yeah, have that communication with them so that they know what to expect. We had a conversation about bringing in a chopper. Is it worthwhile to bring in a chopper to our field? Do we need to know what those coordinates are? They looked around our field and said, we'll never bring a chopper in here. I can get your kid loaded up into the rig and get him to the nearest hospital before the helicopter will even land here. So that's census. We don't need to call for a helicopter here. So that's not part of our emergency